Hi everyone, Dr. Carrie Vajant here from Healing Paws Animal Hospital. Just wanting to reach out with another educational piece. It's Wednesday, and I really try to make an effort to reach out on a Wednesday as a point of contact about education, helping you and your pets live a long, happy life together. In response to a video I posted on Sunday from the Canine Arthritis Foundation, there was a video I posted that was really near and dear to my heart. And so if you didn't get a moment to watch that, please do, because it really changes your perception on pets and pain. And I mean, I deal with this every day, but for me, I got a lot from it, and I hope that you as well would get as much from that. So, pain, very common thing I see every day in practice. Clients bring pets in for limping, for reluctance to jump, or slowing down. And one question I always ask them is, do you think your pet's in pain? And I'm really astonished by the overwhelming majority of people that answer, I don't know that they are painful. They're still eating and drinking, and they still want to play. And it couldn't really be farther from the truth. The reality is that if your pet's limping, if your pet's slowing down, or they're reluctant to jump, those are painful pets. It's a tough pill to swallow. No one really wants to really think about their pet in pain because it really hurts our hearts, but they are painful. And the difference that separates them from us is that they don't complain. Something's ailing us. We're limping. We're telling someone about it, we're popping medication for it, and we're calling our doctor. That's something that your pet can't do for themselves. They can't be an advocate, and so they really rely on us to help them through that. So when a pet's not complaining to you, they're not whining, they're not crying, they're still eating and wanting to be playful, we think that they're not painful, and the reality is that they really are. So the common things that I'll see is, a pet will come in limping. A pet may come in because they don't want to jump up. Maybe the cat's not wanting to jump up on the bed like they used to, or the dog is really slow to get up, but gets a little better as they get going throughout the day. But if they overdo it, they get slow again that next day, or they pay for it for a few days after that really long walk that you took. It's more than just being worn out and tired. Those are painful animals. Something else you'll see is that they'll be arched in their back. So I joke because I do this in front of clients all the time, so you're going to get to see this. But I'll ask them, so, the hypothetical Mrs. Smith, do you think Fluffy's painful? And they're hunched over and they look really painful to me because I see it all day, and they're like, no, I don't think so. I'm like, okay, I'm going to stand and walk like Fluffy is. You tell me if you think I'm painful, and I'll be like this, walking around. And they're like, well, yeah, you're painful. And it's like, look at Fluffy. And they're like, oh my gosh, they are painful. So those hunched over animals, those animals that don't want to lift their head up, they're sore, they're really guarded, those are painful animals. And it's definitely reason to reach out to your vet, to me, to seek some guidance in identifying what that problem is. So once we identify they're painful, there's diagnostic tests that we want to do to try to identify what's causing the pain. Is there arthritis? Maybe we need to check them for Lyme's disease. There's so many different things that I won't go into detail with you today about because it's overwhelming. But ultimately, I'm going to kind of take that conversation to what things do we do to help pets that are painful. And I have a couple modalities here for us to review. One here in the center is a K-laser, and a K-laser is a therapeutic laser that we use to treat pets that are painful, and it uses actual laser light to increase the blood flow and the oxygen concentration in that area, and we find it works well for chronic pain, for acute pain. There's so many other reasons outside of pain that we use it, but right now I'm just talking about it for pain. There's multiple settings on this particular model. I have a K-laser, and we pick the species that we're used and move forward with it. It's non-painful. Pets do so well with it, and clients really like it because it's a non-medicinal. It's not a pill that you're having to pump into the pet. So that's really a cool option. Over here on this side are nutraceutical products that I recommend, and one is Dowsaquin. This is a glucosamine and chondroitin, and we have it in both for cats and for dogs. And this really helps improve the health of the joint. It doesn't do anything for pain directly. It's an indirect pain controller, for lack of better terms. Just by helping improve the joint health, you can improve pain indirectly that way. And then this other nutraceutical here is called Wellactin. And this is an essential fatty acid. And we know that these essential fatty acids help reduce inflammation, antioxidants. They really just help with not only joints, but other parts of the body. So these two together I always recommend. Over here are anti-inflammatories. The ones that I currently carry are a generic form of carprofen, Galliprant, and Minoxidil. These all work great at reducing inflammation at the site of where the problem is. And the other class I use is gabapentin in a pill as well as a liquid, and that also helps control pain together. So after going over all of this stuff, my goal is to hopefully give awareness that pets are painful, some signs and symptoms that you can look for to help identify that in your pet, some options that we use to treat for it, but ultimately you need to see your vet, whether it's me or your other vet. Really we just want the care to be given to your pet, and if I can help you in any way, reach out to me. I hope you guys have a great day.